to talk about diastasis recti. Within female runners, we find a lot of people come to us after just having given birth and they want to get back into running. And when we say, have you been checked for diastasis recti, the majority of women have never even heard of it. And it's something you really want to be aware of before you start running. So I'm going to talk to Dawn about what diastasis recti is and how to be checked for it.
Yeah, I mean, so after I gave birth, I thought maybe someone would ask me these kind of questions. At the time, obviously, there's issues about breastfeeding and all those kind of things, and it does get a bit skipped over. So basically, diastasis recti is a separation of your abdominal muscle. So it would be your six-pack, that line down the middle, separates. It separates in most people during pregnancy. About 66% of people get a diastasis recti. Obviously, it's more likely if it's your second or third pregnancy. It's more likely if you've carried twins because the strain on the abdominal wall is greater. It's really normal that it separates. However, before coming back to running, you want it to come back together.
And if you're fitter when you're carrying, or you've done a lot of core work, is it less likely you get it, or?
It's less likely if you've done something like Pilates, which is very core focused. Sometimes ladies who like the gym and go back to the gym too quickly actually suffer worse because it's all the outer abdominal stuff which almost draws it apart rather than brings it together. So what I'll do is I'll check it on you. If you have a lie down. So the reason we don't want you running with diastasis recti is your abdominals support your pelvis. So if you go back to running with diastasis recti, you're running the risk of sacroiliac joint problems, pelvic girdle pain recurring, and also your abdominals help out your pelvic floor. So if your abdominals haven't come back together, there's increased strain on your pelvic floor, and that's continence issues and all that kind of stuff. And also when you're having a kid, you just want to be able to run and get on with it. You don't want to be struggling with injury. So I'm just going to roll this up a second. So you put your fingers in just below your belly button. So don't worry about your belly button. It's a natural hole in your abdominal wall. It's always going to feel worse around here. And we measure it in fingers breadth. So I'm going to put my finger there. This is not an exercise to do, this is just how we check. Just do a kind of a naughty little sit-up for me, okay? And as you come up, I would feel with my fingers if there's space between the two sides of the abdominal wall. So rest your head down. So 1 to 1.5 fingers is considered normal. You wouldn't get treatment for that of any kind. Any bigger than that, and you want to start working on that core very specifically before returning to running.
And presumably someone couldn't do that test on themselves, but they could potentially get a partner or a friend to do it.
You can kind of do it on yourselves. Most women have an awareness of something doesn't feel right in their abdominal wall. And I would suggest if you feel that way, yes, try and check it yourself, but get a physio to check it or a friend to check it. And say we can put up another program on one of our videos of steps to go through to healthily return to running.
And also, I think another point to make is even if you're 1 year, 2 years down the line.
I've seen people 3 or 4 years down the line who have low back pain when running or pelvic girdle pain, and it's still treatable at that point. There's still things you can do.
Okay, so you can check out our program about how to deal with diastasis recti that will be online soon.
Is that really long? I should have added.
How long was that?
That was 3:20. It's still not stopped recording.